Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices. 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES, for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we have a caller. Good morning.
Good morning. Am I calling the wrong time to receive the DVD and the booklet?
Yeah, for the booklet and DVD, call our same number, 212-CHOICES. Call us Monday through Friday, 9 to 5, and we'll put it in the mail to you at no charge.
Okay, thank you.
9 to 5, Monday through Friday, okay?
Thank you.
Thank you. God bless you. Okay, so if you want the booklet, you know where to call and what to do. We had a gentleman come in this week who I saw 6 months ago. At that time, he'd already had prostate cancer diagnosed 5 years before, and he refused treatment. For 5 years, he refused treatment, even though he had a Gleason 8 cancer. Now, Gleason was a pathologist, told us how aggressive the cancer was. The higher the number, going from 2 to 10, the worse the prognosis. He had an 8, so he had a high-risk cancer 6 years ago. His PSA has been going up. I saw him 6 months ago, at which time his PSA was 11, Gleason 8. At that time I saw him. I told him the risks and benefits of treatment. He had a chance of cure, which was pretty good. And then I didn't see him for 6 months. He came in this week, repeated the PSA. It's now 20. Actually, it's more than 20. So his PSA is doubled in 6 months. This man's in trouble. He's been doing watchful waiting for 6 years, and he's in trouble. It's time to get going. We're going to try to take this call. 1 minute. Radiosurgery New York, you're on the radio. You have to call us Monday through Friday, 9 to 5, and we'll send you whatever you want at no charge, okay?
I didn't understand what you said.
Call the same phone number, Monday through Friday, 9 to 5, and we'll put the booklet and DVD in the mail to you at no charge.
Well, I can't tell you the address now.
No, you're on the radio. 50,000 people are listening to you. Call the same number, Monday through Friday, 9 to 5, okay?
Thank you. Bye-bye.
Thank you. God bless you. So this gentleman who went on an intensive multivitamins, high-dose vitamins, supplements, herbs, what did it get him? It got him into big trouble. And we're now restaging him. Hopefully his cancer hasn't traveled. I hope it hasn't. We're getting repeat staging to see where the cancer is exactly. Hopefully it's localized, and hopefully has a chance. But it's a lesson. This man's on herbal therapy. His PSA doubled. All those promises, they're fake promises. Herbs and vitamins are unregulated industry. Just like Dr. Oz is swallowing his words, this patient may die because he listened to all those fake words. So please, If you have a question about cancer or prostate cancer or your cancer or a mass or a lump, please call us, make an appointment, come in. Don't be a loser. This man may be a loser because he listened to all those ads, he bought all those products, he wasted his money, his PSA doubled, he is in trouble. And here's a gentleman, similarly, 63-year-old Hispanic man, Spanish-speaking, came in with his 3 kids. He had flank pain in 2012. He was found to have kidney cancer, metastatic to lymph nodes. Went to a hospital in one of the suburbs. Another call. Wow, a lot of callers today. Hello, good morning. You're on the radio.
Yes, hi. Your show's terrific. Just have one quick little question.
Okay.
And I like your advice, but I'm just curious, when you speak about a woman coming into the office or a man like a fellow with prostate cancer or a woman with a tumor, why did you say they were a black person?
I describe who they are so you can have an idea who they are. I don't have to. They're all people. They're all human beings. Everyone's treated the same. We take care of everyone. We spend all their time. I try to give information so you get an idea and more information about each people. If you don't like the show, that's your business. I'm sorry. Sorry to offend you.
I like the show. Don't get me wrong. I like the show.
Well, great.
Your tone of voice. I like everything.
Well, why do we say it's a man or a woman? Why do we say their age? Why do we say anything? We say things in medicine because black people, for example, have twice the mortality rate of white people with prostate cancer. Did you know that?
No, it didn't.
Did you know that black women have twice the mortality rate of white women with breast cancer? Did you know that? It's not all equal. It's not all equal. There's higher rates of cancer in certain cancers in certain groups. Certain people are at higher risk. And so in medicine, if you're a medical doctor, one doctor talking to another will say, this is a black patient, 62 years old, or white, or Ethiopian, or whatever, because there's differences in each group. Each group have higher risk of cancer. A black man will have a higher risk of dying from his prostate cancer than a white man. So it's really important to understand who the patient is, what the risk factors are, and then give each person the best treatment, not the same treatment, the best treatment based on their situation.
That was a perfect answer. I appreciate it, and I thank you very much.
All right. God bless you. Bye-bye. Yes, and there's also other studies that show that poor people get less second chances for their cancer than other people. So each person is unique. I'm not being racist. I'm trying to be as descriptive as I can for each person. So this is a 63-year-old Hispanic man, had kidney cancer, had surgery on his kidney, even though it was metastatic at the time 2 years ago, and now comes in with multiple metastases from kidney cancer. He's at a big cancer hospital. He's been on 4 protocols. Now, what is a clinical protocol? A clinical protocol is a treatment that has no basis other than hope that it's going to work, and they're using the people kind of experimentally so they can report back. Usually the hospital gets paid money from the drug company for these experimental protocols. Usually the patient pays the hospital for these protocols. He's had 4 protocols for kidney cancer. None have worked. I saw him with metastatic cancer, even though he had nephrectomy, even though he's had 4 clinical protocols at a big cancer dancer hospital. What does radiosurgery do for kidney cancer? I can tell you that we've been treating kidney cancer for 20 years. We can treat it in the kidney or where it's metastatic. The control rate is over 90%. My son, Gil Lederman, just published a paper, an abstract, where the control rate of kidney cancer to the lung is 97% where we aim the beam. So kidney cancer was always thought to be radio-resistant. Actually, it's very sensitive to radiation when it's used with radiosurgery, which is focused beam treatment. So very interesting for this man that he does have a second chance, even though surgery didn't help his kidney cancer, even though 4 protocols didn't help his kidney cancer. We're just about at the end of the hour. I just want to tell you a few minutes about our facility, which is Radiosurgery New York. This is Dr. Lederman speaking. Our facility is at 1384 Broadway, which is the corner of 38th and Broadway. We're between Macy's and Times Square in Manhattan. We have a spacious, modern, new cancer treatment center. Linear accelerator treats the patients. We have CT scan to do radiation planning. We have our own operating room to do brachytherapy. We have hyperthermia machines, one of the few centers in the nation that gives hyperthermia treatments to select cancers, because we know that certain cancers will respond better with hyperthermia. We take most insurances, Medicare and Medicaid. You've heard from lots of callers requesting that booklet DVD. Just call us during the work week, Monday through Friday, 9 to 5. We will send it out to you at no charge. If you have medical questions, call us, or better yet, make an appointment at 212-CHOICES, 212-246-4237. Thank you, and God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 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 12